Good afternoon. Thank you guys for joining us today for a conversation on former service members' suicide prevention. My name is Cherie Pham. I'm the co-founder and vice president of programs and initiatives at America's Warrior Partnership. We are currently overseeing Operation Deep Dive, a community-based former service member suicide and non-natural cause of death prevention study taking place in 13 states across the country to include New York. It is led by our team at America's Warrior Partnership and researchers from the University of Alabama with the generous support from the Bristol Myers Squibb Foundation. Today, our goal is to share with you the best practices and resources available to support prevention efforts around suicide and non-natural causes of death for those who have served in the military and live in New York. I'm pleased to have Marcel Leese, the Director of Veteran Services at the Association for Mental Health and Wellness, and Beth Murphy, the Senior Deputy Commissioner of the Suffolk County Department of Labor. Marcel.
Thank you so much, Cherie. I'm honored to speak here today with you and Beth about suicide prevention and non-natural death prevention as well. Just a little bit about myself. I am a career airman. I had served in the Air Force, stationed at the 106th Rescue Wing, New York Air National Guard, for 24 years. Since my retirement in 2013, I have been working with the Association for Mental Health and Wellness, first as a veteran peer mentor for 5 years before being promoted to my current leadership role. As the Director of Veteran Services, I am proud to oversee our agency's programs that provide emergency and permanent housing, as well as the Joseph P. DWYER Veterans Peer Support Project. The DWYER Project, as we refer to it, is a New York State Senate-funded program that engages veterans with support and provides connections to community as well as VA resources. I will go further into detail regarding the programs as we move forward in this discussion. I am ready to dive right into our conversation, but first I'll turn it over to Beth.
Thank you. Thank you. Much appreciated, Marcel, and thank you, Cherie, for this opportunity. My name is Beth Murphy. I'm the Senior Deputy Commissioner of the Department of Labor in Suffolk County, Long Island, New York. For the past 30 years, I've resided in Suffolk County, grew up in Nassau County, Long Island, and I'm lucky enough and fortunate enough to be a part of this wonderful program today to discuss suicide prevention and non-natural causes of death. My background is in counseling. I have a master's in counseling, and my background is in teaching. Upon graduation of college, I became a teacher and realized that I wanted to work with others in the counseling profession. Left counseling, and in the past 12 years or 10 years or so, have actually worked with veterans in the Suffolk County Department of Labor, helping them with underemployment and unemployment in Suffolk County. We're finding that, if you're underemployed sometimes or unemployed, that is a protective factor that we need to help get those veterans back into the communities, which they deserve. So I'm here also as well as the program manager for the Mayor's Challenge. The Mayor's Challenge is a program to help prevent suicide amongst veteran service members and their families. New York State was the only county Suffolk County was the only county in New York to be represented by the Mayor's Challenge. I will discuss that a little bit further, but it's a partnership with the United States Veterans Administration. It's the Health and Human Services Administration, and also the Department of Defense, as well as the Human and Service Administration, helping others. So we're here today. I'm excited for this opportunity, for this discussion, and thank you for having us. And I'll talk more about the Mayor's Challenge in a bit.
Yeah, great. And Beth, I can't tell you how excited I am to share the great work you're doing in New York and how we can work together as communities to develop an upstream approach to suicide and premature death among our former service members. Before we begin, Marcel, can you share with our viewers what the state of New York former and active duty service member terrain looks like?
Yes, Cherie, I can. So first of all, I want to share that Suffolk County, Long Island, is home to the largest population of veterans in New York State and one of the largest veteran populations of any county in the United States. Nassau and Suffolk County together as a region, we are second only to San Diego in the veteran population. In 2018, New York State had the sixth largest number of individuals enlisted in the armed services with more than 6,000 recruits. This means we have a special responsibility to help ensure those who have served our country receive appropriate support when it comes to securing decent, affordable housing, training and employment opportunities, mental health assistance, and other necessary services. The terrain here on Long Island is very unique because we do not have a large active duty construct. We are more of a guard and reserve component with a 1/3 population within them that are active duty. What does that mean to us? That means with the community-based support resources that we have through the DWYER Project and our partner agencies, we need to work twice as hard to be able to find veterans that are at risk and help them connect to the resources that are available, both at the VA and through the community outlets. In the 20 years now almost that we've been in a major conflict overseas, we saw a large demographic of Guard and Reserve being called to duty multiple times for deployment. And what that looks like when they come back is that when you leave active service and you're in the Guard or Reserve, you go home to your community, which isn't necessarily in the same location as the resources from the base that you've served at. So that, again, is another reason why we have to be so careful that we, find those places where veterans congregate, such as the VA. I also want to mention that not every veteran receives VA services for various reasons. And so that's another thing. If anybody here as a veteran that is out there that is watching this program today, I highly encourage you, if you're not connected to the VA, to register. The VA has wonderful services, and it's easier for us to help connect you with other community-based providers if we know you're here in our county, especially here in Suffolk County.
Yeah, Marcel, I couldn't agree with you more. And it's so important when you were discussing the DWYER program and everything around there, it's so important to holistically look at both the individual and the family members, right? Because that's what makes up the community, and particularly with what you're discussing around the National Guard and Reservists, they are returning to their community, hence their family. And how do we continue to support that network for them on and off of deployments or on and off of their service that they're doing in the National Guard? Could you please share with our viewers, Beth or Marcel, whichever one of you would like to take this, share with our viewers more in depth of what your mission is and how you collaborate with statewide efforts to improve the quality of life for veterans in their communities?
I'll just start quickly with the Mayor's Challenge.
Okay.
We just recently were honored because we have a letter that stated we're now in the Governor's Challenge. So that was an exciting letter recently. But the Mayor's Challenge, we have 25 members, partnerships in Suffolk County, non-for-profits, hospitals, the United Way, the DWYER program with Marcel, and the Association of Mental Health and Wellness, the Sheriff's Department, the Police Department, all our county organizations, Department of Labor, the Mental Health Community Center, our response crisis hotline. So I could go on and on. Our hospital system on Long Island is a part of the Mayor's Challenge. And our goal is not just to help the military service members, it's their families, as you said, Cherie. They're an important part of this process. They need to be involved. And we're seeing some of the veterans that are not going to the VA, as Marcel said, and 60% or more are not going to the VA. So as part of the Mayor's Challenge, we sat down as a team and we did a crisis intercept map, and we looked at problems or things that we thought could be better on Long Island in Suffolk County. And we're now starting to work with the Nassau-Suffolk Hospital Council to coordinate with local hospitals to start a veteran ambassador program. This will be a unique program. This is something new to New York, where a veteran is trained who's employed by the hospital system and is vetted and trained specifically on how to work with veterans, their battle buddies. In a distressed environment in a hospital, which it can be, they will now take that stress out off of that individual and help them with resources or anything that they need, veteran benefits, maybe housing, as Marcel has spoken about, or labor, which you know is the protective factors in helping a veteran stay safe and alive. So we are excited about that new program that will start possibly in the fall. And we're also excited about one other opportunity, which we are working on with the Suicide Coalition of Long Island. We partner with a lot of organizations on Long Island, and we are starting something called the Signum Project, which is, Signum stands for miracle or a sign. And we want to have signs across Long Island where veterans go. It could be a liquor store. We're going to go to gun shops, and we're going to go to tattoo parlors to place the National Suicide Hotline stickers at the cash registers or the restrooms or where the individuals might locate in those places, and train the staff there to see if they see someone struggling in a Safe Talk program, so they know what to look for and the questions to ask when those individual service members might walk through the door. So we're excited by that, and we will need volunteers, and we're going to look forward to that in the fall as well. And that's one of the many things that the Mayor's Challenge is doing on Long Island and Suffolk County, and we're excited because our goal is to help heal the scars of some of the veterans here on Long Island and Suffolk County.
That's wonderful. Those are great successes and great moving forward. Well done.
Thank you.
Marcel?
Yes, I'd like to first just go over the mission of the DWYER Project and speak a little bit about who Joe Dwyer was. The mission is to assist veterans, service members, and their families to achieve and sustain personal health, wellness, and purpose in their post-service lives through the support of trained veteran peers. So what does that mean? Our veterans that work within the DWYER Project, yes, they've served, and they're veterans, they're service members, they're people that have had lived experience, and that brings value to the relationship building when we're trying to work with a veteran that may not feel comfortable outside or have lost their sense of identity and purpose when they left the service. That is very common in the veteran population, that when you leave, you lose your identity. I can share with you from my experience after being in the uniform for 24 years, I struggled with my own identity when I left, because you literally wear your identity on your uniform, your name, your rank, your branch of service. It's all there, and you're part of something that's bigger than you. So that when you leave that sense, that camaraderie and that place where you know somebody has your back, whether you've had a healthy experience in the military or you've struggled or have post-traumatic stress or have had a negative experience, we all go through something. And that's really important to understand and recognize when we move forward in the relationship with somebody who's coming out of service, whether they were in service during Vietnam or the modern post 9/11 OIF, OEF conflicts and everything else in between. So that's a little bit about, that's just a framework of what we do. The DWYER Project was established in the name of Joseph P. Dwyer. For you folks that don't know who he is, Joe was inspired to join the military on 9/11. I know Joe's story through his family. I did not know him personally, but I've gotten to know him through his family, and what he lived for in honor and helping and healing. He enlisted as a combat medic in the Army to serve and help others, and save lives, not to take lives. If you've ever seen that iconic photo of the Army soldier with a weapon slung behind his back with a small Iraqi boy, that photo was taken in about 2003. It was literally the photo that was shot around the world, and it really iconically was the symbol of what was going on over there. Joe had multiple deployments, and he struggled openly with his PTSD, and there weren't peer programs at the time for somebody to talk to them. One of the things about being in the military is we find we're strong, resilient warriors. So it's very difficult for us sometimes to ask for help because we're supposed to be the helping professionals. And Joe faced those struggles openly. Joe unfortunately died accidentally while self-medicating because he was struggling with that PTSD. He was hurting. And the signature wound of these wars is post-traumatic stress disorder. And it's not a wound you can see. And many of us come back from it and they don't know what to do with it. Working within the mental health system can be challenging. And that's why the DWYER Project was established, to be able to normalize asking for help, to be able to have a veteran or service member come back from wherever and say, I see that you've been through it, modeling healthy behaviors, and You know, we want you to come and help us through that journey. And that's really what the DWYER Project, the foundation of it. A lot of what we do in the community is engagement with the veterans and training and education for the rest of the civilian population, because we know that veterans were people too, and they don't always go for the veteran specific or service member specific resources. So we have to think outside the box. And so we've done a lot of partnering and community education around veteran cultural competencies so that the community service providers can understand and recognize something as we learned, don't ask if they're a veteran, ask them if they've served in the armed forces, because many veterans do not embrace that identity for multiple reasons. Women specifically do not always embrace their veteran identity. And if you're a service member currently right now, and you're not out of the service, but you've served towards duty, you might also not consider yourself a veteran. And that sometimes puts barriers up to care. So that's one of the things that we work with within the DWYER Project. Another thing that we work through my agency is housing veterans. I mentioned earlier, we have emergency shelter and we have permanent houses for veterans to find their security and get themselves back into the community, working and feeling like they have that sense of purpose. There is a lot of mental health issues that we see with that. So we do have care management teams that work with them through that environment and with the peer through the DWYER Project to help them succeed in their lives. The pandemic was very challenging, and we also found many opportunities to continue to engage through platforms like Zoom and like Facebook to be able to continue to provide services. From the inception of 2013, when we started this program, we've served over 4,000 veterans and their families through the DWYER Project. And I have a success story that I'd like to share with you right now, Cherie, if that's okay.
Sure.
Okay, so this is going back about 5 or 6 years ago. Our project coordinator got a call in the middle of the night on a weekend, which we know when crisis happens, it's not always 2 o'clock on a Thursday. It always seems to be, we find many times in our experience, it's during off hours. And he answered that call, and it was a veteran that was being arrested because of a charge that was probably, and we found out later as he went through the Veterans Court, was directly contributed to his service time and his struggles with PTSD. So this veteran worked with us one-on-one with our project coordinator for a good 1.5 years, 2 years going through that process. And having that peer engagement really helped him overcome some barriers and get him through that process. We were able to connect him to housing and employment resources. And then we find traditionally, once we get them up on their feet, many times they fall off our radar scope because they're doing well. Well, fast forward a few years later, we were at an event here in Suffolk County where the county was giving away 3 houses to veterans and families. Well, this gentleman was one of those veterans, and I get chills when I think about it because he was doing so well. He introduced us to his new wife and his baby, and it was just a clear example of what we did to work with him and work with the community partners to get him to a place where he could sustain housing and employment and thrive and survive. So I thank you for letting me share that story with you.
Yeah, absolutely. And thank you both for all that information. Most of our, if you've been watching these for a long time, you'll notice I usually only have one co-host that I'm doing this with, and you might wonder why I have 2. And the reason why was exactly what you just experienced or heard right there, is the blend between the government in terms of the mayor's challenge, and that's supported by the VA and SAMHSA, but then the direct service provider and how all of that comes together, the program. And I think these ladies do a great job in illustrating that, and I wanted to share that with our viewers. So thank you both for that.
Thank you.
As our regular viewers know, every community is unique and distinct depending on the area of the country where our veterans are located. Because of this, the challenges impacting them in one state may be vastly different from another. As you heard Marcel talk about, the National Guard is a higher concentration throughout the state of New York, and what that brings to supporting the National Guard in their community. Our goal with Operation Deep Dive is to understand these challenges, and more importantly, address how community leaders can resolve them. Now, Beth and Marcel, y'all have touched on this a little bit, but can you briefly kind of, if you could do in a statement with that goal in mind, could you tell us more about how Operation Deep Dive can work in New York?
Sure. I'll speak to that a little bit. Well, Operation Deep Dive is comprised of two components. And the first component is where in New York State we gather the death data. And I'm on a suicide fatality review team here on Long Island as well. So we gathered the data for Operation Deep Dive. And it's from 2014 to 2018. And that data is sent to the Department of Defense, where it's researched to see if the actual individual is a service member or not. And in New York State, we do not give out the Social Security number to the descendant. So sometimes it can be a little bit of a challenge. So we've come up with other ways. And the University of Alabama is helping us, where they are doing research and looking at trends in demographics. And they're looking at also hotspots in certain areas where the veteran might have died by suicide or natural causes. And if you notice the hotspot, they're working in those areas, and also they're looking at not only the hotspots, they're looking at the military history, deployments, as Marcel was talking about, how many deployments, what type of service the veteran was involved in, what branch of service. So the combination of these two components helps, us and partner with Operation Deep Dive to develop strategies and to look at ways to help for future moving forward in the communities that we work with, because it's important to understand the veteran, where they're coming from. And they also are doing things like talking to the family members. This is an important part of Operation Deep Dive. They want to talk to the individual families or the friends or the individuals that were closest to the service member, the former service member, 6 to 12 months prior to their non-natural cause of death or death by suicide. They want to see what they were doing in their communities, how they were engaged. And there's something very interesting we found on Long Island. There was quite a few in our suicide fatality team review that had seen a doctor 2 weeks prior. They had been in a hospital of some sort, or they had been to a physician 2 weeks prior to their passing. So yeah, we found that very fascinating. So Operation Deep Dive, we're excited for the partnership. And I want to thank you again, because the work that we do on Long Island and in New York State is going to definitely help save lives with Operation Deep Dive research.
Absolutely. Marcel, how can New Yorkers get involved with these interviews and become a part of the larger team that's focusing on ending veteran suicide?
Yes. So first and foremost, if you have lost a veteran, former service member, a loved one to suicide, accidental overdose, drowning, asphyxiation, high-speed single driver car accident, or suicide by law enforcement within the last 24 months, I encourage you to participate in an interview with the research team. We want to understand their story and how they were engaged with the community prior to their death. Your insight will give local organizations guidance on how to better direct their efforts, engage former service members, and enhance their quality of life. Just like we say in the DWYER Project, this program does save lives. And we need to know how we can engage these people prior to any incidents and to reduce risk. We are a harm reduction program. And just like I shared that story earlier, if we had not gotten that veteran the help that they need, it could have gone in a very different direction. And we do see that from time to time. If you're not eligible for an interview, there's much more you can do to support Operation Deep Dive. Please consider sharing information about Operation Deep Dive with your personal networks. Alerting a close friend or a colleague about the study can provide them an opportunity to share their story and help reduce the likelihood of veterans or former service members dying by suicide or non-natural causes in the future. In addition to Operation Deep Dive itself, former service members should also understand that there's a wide range of programs and services available to help them overcome challenging situations. If you're facing an urgent crisis, you should always call the Veterans Crisis Line by dialing 1-800-273-8255 and pressing 1. You can also send a text message to 838-255. For more information on our programs and services and initiatives that can support you, you can contact me at, and I believe we're putting it in the chat as well, my email address at the agency is M as in Marcel Lease, MLEIS @MHAW.org. For more information for the DWYER Project, I encourage you to go onto our MHAW website, MHAW.org. And also, please like and follow our Facebook page. And it's the facebook.com is Suffolk County United Veterans. And you can also find those links on our website, on our agency website. We do monitor them daily. And if you also want, if you can instant message us through the Facebook page, that's usually the fastest way, and it's private. It's a private instant message if you've ever used it. And we have it comes up on our phone and we're able to respond. So those are a few ways that you can connect to our programs and services.
The Zoom, the social media goes a long way. And I just like to say, because what you post today on our Zoom call might actually help one individual. And we have a lot of local and national resources during the Zoom call that someone searching, just reaching out, could actually find the right resource for them. And that is what's so amazing about today's event.
Part of this also, the connecting of the veterans back into the community, it's not all about that, but it is important to know, again, because of this initiative, and we are trying to reduce the risk and eliminate suicide, but to reduce the risk, having social connectedness is so important. Again, we found that out as a society during the pandemic. So using social media was our outlet to be able to make sure that we could connect with veterans throughout the country to be able to know what the resources were out there.
We are actually running out of time. So do you guys have anything else you want to add that you haven't had a chance to say?
Yes, Cherie, I just want to mention some additional resources out there that you can utilize. Look in your communities and find out if you find an agency that has a program called Mental Health First Aid for veterans. Again, as a community provider, as a family member, as somebody that everybody knows a veteran, if you get the tools to help, you can identify and help get somebody to the assistance they need if they are experiencing a mental health crisis, which we know increases the risk of suicide or unnatural death. Also, Assist and Safe Talk are two other really great tools that we use with engaging veterans and service members. And I just want to mention there is a program called Psych Armor. And again, I hope you're putting in the chat. Psych Armor is a program that has many, many different online resources, but one of them is to improve competencies around supporting active duty and former service members. It's like Veterans 101 to speak. So anybody can take that course. So I really highly recommend. And I want to thank you again today for giving us the opportunity to be able to share our information.
Thank you, Marcel. Beth, do you have any closing comments?
Sure. I just wanted to say that, as you know, we learned a lot about Operation Deep Dive and the important initiatives that you're working on, and we're working and partnering with you. But we also want to just say that the goal is to keep our veterans safe and to keep trying to help save lives through all these various partnerships that we're involved in. And together, we have to partner to make sure that we definitely, as I said, try to heal the scars that some of the veterans that are coming back or even are in the active, National Guard and all the other service members. We have to work constantly and figure out any way we can to help them. So thank you for today's opportunity and the ability to work with Marcel as well today.
Great. Thank you, guys. I want to do a few little housekeeping type things for clarification purposes. You guys have probably heard us intermittently use the term warrior, former service member, veteran interchangeably in the context of this study. And to ensure that it's clear who is eligible to participate, if you raised your hand and you died by suicide or non-natural causes and your family or friends would like to be interviewed, you qualify. You heard Marcel talk earlier about how some veterans don't consider themselves to be veterans for one reason or the other, and so we want to make it clear that this is, if you raised your hand and you died by suicide or non-natural causes, we'd like to talk to your family member. The goal of these interviews is to understand how a deceased veteran was engaged within their community and how the community can better support the veterans in the future. How can you participate? You must be 18 years or older. You must have a relative, loved one, friend, or coworker who was a veteran and died by suicide or a non-natural cause of death within the last 24 months. The deceased veteran could have served as little as 1 day and received any type of discharge. Both you and the veteran must have lived in the same community prior to their death. Additionally, this community you and the veteran lived in must be in New York or one of these other states participating in Operation Deep Dive. The other states are Alabama, Arizona, California, Florida, Georgia, Indiana, Minnesota, Nevada, North Carolina, South Carolina, Ohio, and Texas. If you're eligible and would like to participate or know someone who may want to participate, please visit americaswarriorpartnership.org/deep dive to contact our research team. Going back to Mr. Dwyer, some of our viewers may ask, what are the non-natural causes? Overdose is included in this study. A lot of times I've talked to persons and they say that, you know, that their loved one died by overdose, or they died by asphyxiation, or they died by other harmful events that led to their premature death. And so I want you guys to know that we've extended this out for suicide and the other non-natural causes to look into how we can support these persons in our community. Thank you guys very much for today. I can't tell you how much.
Thank you. Thank you so
very
much,
Cherie, and your organization.
Yes, thank you to Operation Deep Dive and America's Warrior Partnership. Thank you.